My name is Jackie. I'm secretary for Mr. Raghuvanshi. I've been his practice manager since 2011. When a patient first comes in to see Mr. Raghuvanshi for initial consultation, we obviously will ask them what procedure they would want to have done. So say for example it's a breast augmentation. Mr. Raghuvanshi will first go through all your history with you and take all your details.
A lot of patients are nervous, and obviously Mr. Raghuvanshi does this every day, literally 24/7. So we just say, look, don't worry, just get undressed. You know, we do this every day.
We have a 3D Chrysalix software which we will actually scan you yourself, and you will see what you would look like after you've actually had procedure.
I just kind of stand in front of the patient and go all around. So it's really, really interesting. You get to see yourself, obviously, how you are now, and then what you'd look like after your surgery if you have implants, or if you have a reduction, uplift, all that kind of stuff.
Lots of the patients are thrilled with the results and would like to book in for surgery straight away.
Mr. Raghuvanshi's approach to patient care is very reassuring. He communicates extremely well with the patients and spends a lot of time and is very considerate to their needs.
After Mr. Raghuvanshi has seen you for the initial consultation, we will always ask you to come back for a second consultation. Some patients would rather be over the phone or a Skype appointment, but we would always ensure that you either speak to Mr. Raghuvanshi or see him in person before the procedure. We would then go through the diaries and decide when you would want to have the procedure done, and then we would agree that date. Just before the procedure, you would go in for pre-admission tests at the hospital, which the hospital will arrange direct with you.
Here at St John Elizabeth's, we take a patient-focused approach. It's a very nice environment to be part of, a very safe environment.
If you've got any questions before, I would always try and answer them, or otherwise I'll forward them to Mr. Raghuvanshi, and he will either call you or reply to you by email. A couple of days before the procedure, we'll contact you just to reassure you of your starving times and also what time to actually arrive at the hospital. When you arrive at the hospital, you will be greeted by Mr. Raghuvanshi and the anaesthetist. After the procedure, Mr. Raghuvanshi will speak to you the following day and tell the nurses when to discharge you. I will always contact you after the procedure and actually ask how you are. Lots of you are feeling a bit groggy, a bit from the anaesthetic, which is always to be expected. Then I would always ensure that you've been booked in for a dressing change at the hospital, and also we'll book you in for a follow-up appointment to see Mr. Raghuvanshi after the procedure.